Bismillahirrahmanirrahim. Today lecture is related with function of testosterone. Secretion of testosterone. Testosterone is formed by the interstitial cell of the Leydig, constitute about 20% of the mass of the adult testes. Leydig cell or testicular interstitial cell are non-existing in the testes during childhood when the testes secrete almost no testosterone. These are the seminiparous tubules. These are the Leydig cells. They are non-available during childhood and therefore produce no testosterone. But they are numerous in the newborn male infant for the first few months of life and in adult male anytime after puberty. When a person is become adult, then he start production of testosterone. At about this time, the testes secrete large quantity of testosterone. Secretion of androgens elsewhere in the body. The term androgen means any steroid hormone that has masculinizing effect, including testosterone itself. The adrenal glands secrete at least 5 androgens. In women, they don't cause significant masculine characteristic except for causing growth of pubic and axillary hair. Tumor of the adrenal gland produce large quantity of androgenic hormone cause all the male secondary sexual characteristics to occur in female. Masculinizing effect, growth of hair on the face and other part of the or even on whole body, arms, chest. This is called masculinizing effect. Secretion, degeneration and excretion of testosterone. After secretion by the testes, about 97% of the testosterone bound with plasma albumin or beta globulin called sex hormone binding globulin circulate in the blood for 30 minutes to several hours. By that time, the testosterone either is transferred to the tissue, is rapidly converted by the liver into androsterone and dehydroepiandrosterone excreted either into the gut by the liver bile or into the urine through the kidney. Here, this is the pathway by which testosterone is secreted. Gonadotropin releasing hormone act on pituitary. They produce luteinizing hormone which cause production of testosterone by the Leydig cells, and then they act on various tissue. They are which has receptor in the muscle and receptor in bones. They are either utilized in these tissue or in the skin, or if they are not utilized by these tissue, they are then degenerated and inactivated by the liver and excreted from the body. Function of testosterone during fetal development. Testosterone is responsible for the development of male body characteristics. These are the male body characteristics including the formation of penis and scrotum, formation of the prostate gland. This is the prostate gland at the base of the urinary bladder, seminal vesicle. These are the seminal vesicle and male genital ducts. The vas deferens, epididymis, efferent and deferens, and these organs are developed by the testosterone, while at the same time suppression the formation of female genital organs. Accentuate its effect on male genital organs. Descendant of the testes. The testes usually descend into the scrotum during the last 2 to 3 months of gestation, when the testes begin secreting a reasonable quantity of testosterone. If a male child is born with undescended normal testes, the administration of testosterone usually causes the testes to descend in usual manner if the inguinal canal is large enough to allow the testes to pass. Administration of gonadotropic hormone stimulates the Leydig cell of the newborn child's testes to produce testosterone, cause the testes to descend. indicating that the testosterone is an important hormone for male sexual development during fetal life. Why the testosterone is produced during fetal life and after birth? Because it is responsible for the descent of testes from the abdomen to the scrotum. Development of primary and secondary sexual character. After puberty, the increased amount of testosterone secretion causes the penis, scrotum, and testes to enlarge about 8-fold before the age of 20 years. In addition, testosterone causes the secondary sexual characteristic of the male to develop beginning at puberty and end at maturity. The secondary sexual characteristic, in addition to the sexual organ themselves, distinguish the male from female as follow. Body hair. Testosterone causes growth of hair over the pubis, upward along the linea alba of the abdomen, sometimes to the umbilicus and above. See the linea alba, and here also it causes growth of the hair. On the face, usually on the chest and less upon on other region of the body such as the back. It also causes the hair on most other portion of the body to become more prolific. Baldness. Testosterone decreases the growth of hair on the top of the head. A man who does not have functional testes does not become bald. This is baldness, and it is due to the excessive production of testosterone. However, many virile men never become bald because baldness is the result of two factors. First, a genetic background for the development of baldness, and second, superimposed on this genetic background large quantity of androgenic hormone. When these two, genetic and the large quantity of androgen, combine together, it causes baldness. A woman who has the appropriate genetic background and who develop long sustained androgenic tumor become bald in the same manner as does a man. Effect of skin. Testosterone increase the thickness of the skin over the entire body and increase the ruggedness of the subcutaneous tissue. Development of acne. Increase the rate of secretion of sebaceous gland. These are the sebaceous gland, and here it causes increase the secretion of sebaceous gland. Excessive secretion by the sebaceous gland of the face result in acne. These are the acne which produce when the secretion of testosterone is started in the body. Therefore, acne is one of the most common features of male adolescence when the body is first introduced to increase testosterone. Protein formation and muscle development. One of the most important male characteristic is development of increased musculature after puberty, averaging about a 50% increase in muscle mass over that in the female. So the male muscle mass is 50% more than the female. Here you can see the difference between the male and female muscle density. This is associated with increased protein in the non-muscle part of the body as well. Many of the changes in the skin are due to deposition of protein in the skin. Effect on voice. Testosterone causes hypertrophy of the laryngeal muscle and enlargement of the larynx. The effect causes at first a relatively discoordinated cracking voice, but this gradually changes into the typical adult masculine voice, thicker when compared to women, so higher is the frequency, higher is the pitch. Therefore, woman voice is usually shriller than a man voice. In case of man voice, the pitch is usually low and therefore the sound is flat and grave. Bone matrix. Increased testosterone at puberty, the bone grows considerably thicker and deposit considerable additional calcium salt. Testosterone causes deposition of calcium in the bone. Testosterone has a specific effect on the pelvis to narrow the pelvic outlet. Here you can see in male, this is the male pelvis and it is narrow than the female pelvis. Lighten it, lengthen it. The length is more than the female pelvis. Cause a funnel-like shape instead of broad ovate shape of the female pelvis. This is a funnel shape and this is broad. In case of female, the pelvis is broad and short, and greatly increase the strength of entire pelvis for load bearing, as male exposed to the load more often than the female, so the male pelvis is more stronger than the female. In the absence of testosterone, the male pelvis develops into a pelvis that is similar to that of the female. The ability of testosterone to increase the size and strength of bone, it is often used in older men to treat osteoporosis. Testosterone can be given in case of osteoporosis. Bone matrix. When greater quantity of testosterone or any other androgen are secreted abnormally in the still growing child, the rate of bone growth increase markedly, causing a spurt in total body weight. When the androgen are released in large quantity, it causes deposition of calcium in the bone and increase the bone matrix and causing a spurt in the total body height. However, the testosterone also causes epiphysis of the long bone to unite with the shaft of the bone at an early age. So, two effects. On one hand, it causes increased density of the bone but prevent excessive height of the body, because the epiphysis of the long bone are fused earlier, because it is one of the effect of testosterone that it causes fusion of the epiphysis earlier to prevent excessive height of the body. Therefore, despite the rapidity of growth, this early uniting of the epiphysis prevent the person from growing as tall as have grown. Basal metabolism. Injection of large quantity of testosterone can increase the basal metabolic rate by as much as 15%. Testosterone secreted during adolescence and early adult life increase the rate of metabolism some 5 to 10% above the value that the testes were not active. Effect on red blood cell. When normal quantity of testosterone are injected into castrated adult, the number of red blood cells per cubic milliliter of blood increase 15 to 20%. Also, the average man has about 7 lakh more red blood cell per cubic milliliter than the average woman. This difference may be due to partly to the increased metabolic rate that occur after testosterone administration rather than to a direct effect of testosterone on red blood cell production. Effect on electrolyte and water balance. Testosterone increases reabsorption of sodium in distal tubule of the kidney, proximal tubule, descending, loop of Henle, ascending, and distal tubule. So it causes reabsorption of sodium in distal tubule of the kidney. After puberty, the blood and extracellular fluid volume of the male in relation to body weight increase as much as 5 to 10%. At puberty, the body weight increase by 5 to 10%. Thank you. See you in the next lecture.